Good morning, friends. Today we will discuss the evaluation of a DG patients, how a DG patient should be evaluated in OPD. So what will we be discussing? We will be discussing the general outline of the evaluation and the various descriptions of the dizziness, and the history taking is the most important aspect of the evaluation of the dizzy patients, and that should consist of onset, duration and progression of the symptoms, and the provoking factors means the triggers which can make the patients dizzy. Then we must ask the patient the associated symptoms like ear discharge or the headache or any sensory or motor deficit. Then in the family history, personal history, past history is they are also again very important. Then in the examination we should do the complete ear, nose and throat examination, and that consists of the examination of the cranial nerves and the central nervous system. Then we should look for any nystagmus, and then we perform certain vestibular tests which are little specific in the way that they can induce the vertigo as well as the nystagmus. So we will be discussing about the fistula test, the Valsalva maneuver, Dix-Hallpike maneuver, optokinetic test, rotation test, tandem marking, Romberg test. So all these tests we will be discussing. So I was telling you that the vertigo is a very common complaint. About 54% of the patients of this dizziness, they will have a sort of true vertigo, in the way that the patient will have the spinning or rotation feeling. It's one of the very frustrating complaint in the way that sometimes even patients also they find it difficult in explaining what actually they have, and it's equally difficult even for the physicians also to know what the patient wants to say. Now broadly we can classify the dizziness into 4 groups. So either patient can have a true or a sort of sense of motion, rotation, false sense of motion, rotation, and we call that vertigo. Or the patient can have a sort of unsteadiness or the loss of balance, and that can be called even disequilibrium. Some of the patients, they will have a feeling of floating in their head or sort of